Treatment of hypertension aims to achieve target blood pressure goals based on age, risk factors, and other associated pathologies. Initial management involves lifestyle modification such as losing excessive weight, particularly if overweight or obese patient, which can significantly lower blood pressure levels. Smoking cessation, sodium restriction, alcohol limitation, and managing other cardiovascular risk factors, as well as a regular physical activity and stress management. There are 5 equally effective pharmacological therapy classes treatment. First one is thiazide diuretics and potassium-sparing diuretics, which have an impact on the vasodilatory system and can reduce blood volume through increased renal elimination, as well as potentiate the effect of other antihypertensive drugs. Beta blockers primarily act on the heart, reducing the cardiac output and the blood pressure. They are indicated especially in patients with coronary artery disease, but are not the first-line choice for uncomplicated hypertension. ACE inhibitors are commonly used in diabetic patients due to their lack of metabolic side effects. ARBs have similar effects and contradictions as ACE inhibitors. Calcium channel blockers are preferred in elderly patients. We will talk about this medication in separate videos. Treatment indications depend on cardiovascular risk assessment. If patient is in low risk stage, starting with lifestyle modifications alone can be a choice. For moderated risk patients can receive lifestyle modification for 3 months, and high risk patients require lifestyle modification plus a medical treatment. Treatment should start with monotherapy as a first-line approach. If the blood pressure remains elevated after 1 month, combination therapy might be considered. However, combination therapy can be initiated early in patients with high cardiovascular risk. If combination therapy fails, triple therapy with at least 1 diuretic is recommended. If hypertension remains uncontrolled despite triple therapy, it is considered resistant hypertension. Therefore, renal denervation using radiofrequency may be considered for this case. Thanks for watching.